Hi, Dr. David Morris with Magnolia Medical Center. Today I'm going to be the supplement police, all right? So I'm going to talk to you about a particular problem that is pretty prevalent in human beings. There's a, there's a genetic malformation or genetic defect that about 40% of the population has, and it's a gene called MTHFR. And you can use your imagination and understand what we call it behind closed doors. But it's called MTHFR. Many of you have heard of this. Many of you have not. But one of the problems with this gene, the reason when you have a malformation of this gene, it's an issue, is one of the most common symptoms that people have is anxiety and panic disorders. Okay, so if somebody has a defect in this gene, it can really impact their life. They can really have a problem being in social circumstances. It can really just force them to kind of be a hermit and stay at home. Everything bothers them. So if you suffer with high levels of anxiety, you don't necessarily need to know if you have a defect in this gene, but you do need to make sure the supplements you're taking and the diet that you're eating is not contributing to the problem. So I'm going to explain. So what I'm going to want you to do when you finish watching this video is want you to go to your cabinet where you keep your supplements. And I want you to look at every single bottle that you have, and if it has anything on it that says folic or folic acid, take it out of your cabinet, throw it in the garbage, okay? The reason for this is because if you have a defect in this gene, you cannot convert very easily folic to folate. Okay, now folic is the man-made synthetic version, very easily produced in a factory or something like that. It's a man-made synthetic version of something that our bodies need called folate. All right, this is extremely important. Folate is an extremely important factor in neurological development. This is why moms are told to take, incorrectly by the way, if you're pregnant and watching this, if you've been given folic acid by your provider, throw it in the trash, okay? Throw it out and find a supplement that has folate, methylfolate, okay? Because folic acid, if you have a defect in that gene, will not do you much good. And the whole reason that your provider, your OB/GYN, is telling you to take folic acid is for neurological development of that growing baby in the womb, all right? It's very important for neurological development. And if you have a problem with this gene, you're going to have a problem converting folic acid into folate in your body. So anything you're taking there can actually become toxic and truly increase that anxiety, because this can build up and it can actually increase those anxiety and panic disorder symptoms. So and I'm not, even if you don't have anxiety and panic disorder issues, you should not be taking folic acid. You need to be taking folate, like a methylfolate. Okay, now if you don't like taking supplements, where can you get folate? All right, green leafy vegetables, preferably raw, uncooked. So salads are going to be a great source of folate, like spinach, kale, and again, preferably uncooked, but you're going to get some of that from green leafy vegetables, even if they're cooked. So if you don't like taking supplements, stock up, pound that green leafy vegetables, so that you can get that folate in your body. It's going to help you neurologically. These are things that are going to help those anxiety symptoms. If you're suffering with that, pump up those green leafy vegetables and throw out that folic acid. So this is your supplement police for today. Don't take folic acid. Get some folate, preferably methylfolate. That's what's going to be most easily used in your body. And if you want to do a genetic test, you could do 23andMe, you could do Ancestry.com. There's lots of ways to get your genetic information. And you can find out if you have a defect in that gene. I personally have one. My wife has a defect in that gene. We've done our genetic testing on this. And we can even help you, if you're a patient here, we can even help you interpret your genetic tests. So hopefully you found this helpful. If you know anybody who has anxiety, they have just, truthfully, anything that unfortunately the psychiatric industry doesn't know a lot about what they're talking about. They actually do a lot of guessing, and they really don't even ever talk to anybody about their diet or supplementation. Not a big fan of just throwing pills at people for no reason. But almost everybody, about 50% of the population at some point has been prescribed some sort of antidepressant or anti-anxiety medication. If you know somebody that has been prescribed those things, they need to know this information. So hit that share button and share this with your friends and family so they can get this information and might be able to help them. Folks, thanks for watching. It's Dr. Dave Morris with Magnolia Medical and the Supplement Police. Have a good day.